What you need to know about mouth cancer. When it comes to cancer, we all like to think we know the major players. We know how to check our breasts for cancer. We know the aptitude of skin cancer. We know that ball checks are key for catching testicular cancer. But what about mouth cancer or oral cancer? They're the same thing. Do you know how to check for mouth cancer? Do you know the symptoms, the causes, or the consequences? If you're anything like us, probably not. Mouth cancer doesn't get as much press. We've never heard of anyone doing a mouth cancer 5K, and while any lump or bump makes us think cancer, no issues with our mouth would make us think the same. As it's Mouth Cancer Action Month, we spoke to dentist Dr. Raha Separara to get informed, who told us that, while there's been an increase in diagnosis of mouth cancer in the UK, lots of us know nothing about the illness. 1 in 10 people is completely unaware of the threat of mouth cancer, despite the latest figures showing that around 18 people each day are diagnosed. Mouth cancer cases have increased by a third in the last decade, and it's one of the few cancers that experts predict will continue to increase in the coming years. So it's pretty important to know about it. Here's the key information. The most common type of mouth cancer is squamous cell cancer, which can be found in many places around the body, including inside the mouth and the skin. Less common are sarcomas, salivary gland cancer, also known as adenocarcinomas, lymphomas in the mouth, and oral melanomas. If you're someone with health anxiety and will immediately think any pain in your mouth is cancer, don't panic. There are specific symptoms that can indicate mouth cancer, but a check with a dentist will be able to confirm whether it's anything to worry about. Your dentist should be doing a mouth cancer check during every routine checkup. That's why it's important to go for regular dental appointments. The dentist, before checking inside the mouth, checks for any lumps or bumps visible on face or neck, Dr. Separara tells metro.co.uk. Then we check inside the mouth. We check the lips, cheeks, roof of mouth, floor of mouth, tongue, top, bottom, sides. Generally check the skin of all parts of the mouth. This is why we ask to stick the tongue out, so we can check all aspects of the tongue. I remember when I started my career and I would ask my patients to stick their tongue out to check for oral cancer lesions. Some of them thought it was funny, or they felt they were being rude at sticking their tongue out at me. I explained to them how important sticking the tongue was, as I could check for any signs of cancer. You can now ask vets for a drug to calm your dog's anxiety on bonfire night, please. Don't tell people conscious of their weight they're being stupid. I am living inside a nightmare. This is what it's like to experience psychosis. If we spot anything like an ulcer which we are unsure of, we may review and ask the patient to come back to see us after 3 weeks to ensure it is healed. If it doesn't heal, then we refer to hospital for a biopsy. Luckily, most of the time it is nothing sinister and does not require a referral, or if it does require a referral, most of the time, the tests at the hospital reveal nothing worrying, but may indicate that there may be some nutritional deficiency like iron deficiency of vitamin B12. If at the checkup appointment we notice something that is worrying us and just does not look right, we would send an urgent referral to hospital for a further review within 2 weeks. If your dentist does not do a routine mouth cancer check, request that they do. If you notice any symptoms, go to your dentist or doctor as soon as possible. You're at a higher risk of mouth cancer if you smoke or drink alcohol, especially if you do both at the same time. The human papillomavirus is another risk factor, which is why charities are working to introduce a gender-neutral HPV vaccination program. It's currently only given to girls. Poor diet and second-hand smoking have also been seen to increase risk. Between my team of dentists and myself, we have spotted cancer on 12 of our patients in our combined working career of 25 years, says Dr. Separara. Luckily, most of them were detected early as they were regular patients. The 2 of those who came to us as new patients unfortunately did not make it, as they came to us too late. I want to stress the importance of regular dentist and hygiene visits as we carry out important oral cancer screening at each checkup. Macmillan appoints digital nurse to combat fake news. Online woman who ate asbestos as a